Thousands of cardiology patients who were told there was no treatment for their heart conditions, no hope for them, now have access to a life-changing, dare I say, life-saving procedure, thanks to a doctor at Banner University Medical Center.
So it turns out he's been working on a revolutionary treatment for replacing damaged heart valves. KTAR's Colton Krolak is joining us in studio to talk about it because it's pretty remarkable. What is this treatment and what is it for?
Yeah, I always love hearing these really cool stories about new inventions that are just completely changing the landscape of treatment for people. So this treatment specifically is used to treat a condition called mitral annular calcification, also known as MAC, where there's a leaky heart valve, there's calcium buildup on the heart valve that makes traditional open heart surgery very, very risky for patients. So that hasn't always been a good option. So patients who can't even walk to the mailbox because of some of the symptoms that they have because of this worsening heart valve now have kind of a second chance at this. So the condition affected about 30% of older adults. And like I said, this treatment is really for people that didn't have another option because really it was quite risky, potentially even fatal to undergo open heart surgery.
And it's remarkable that these patients can even avoid open heart surgery.
Yeah, so this treatment, it's basically, it's called a Tendyne device. It gets implanted through a small incision in the rib and kind of blows up balloons in the heart valve so that it prevents leakage. So they're able to avoid the open heart surgery, do a really, really small incision instead, which is obviously a lot safer. So spoke to Dr. Paul Saraja, the doctor from Banner University Medical Center in Phoenix. Talk to me a little bit more about that.
Cutting open a patient, putting them on bypass, cutting or debriding the severe MAC and calcification, which unfortunately can tear, it can leak, and as a result, the patients can die. In the previous experiences, the risk of death with traditional open surgery was 8 to 10% or more. And with the off-label valve therapies that people were trying, the risk of death was as high as 25%.
That's scary.
God.
Yeah. So it's still risky. He said there's about a 6% chance of death, but obviously a lot better than the 8 to 10 and
or
the
25%.
Exactly.
Right. So, I mean, what have patients been saying? How have they been responding?
So, according to the study, Dr. Paul Saraja said about 95% of patients were saying they had improved symptoms and that basically improved symptoms, improved quality of life. So they've been extremely thankful. And he also just kind of told me just what an impact this has been making on them and how they've been responding.
They're just really grateful for the years that they've been given. So a lot of wonderful stories of how we've impacted our patients' lives that way. Essentially, you can think of it as like if you were to have cancer or something life-threatening, and then somebody shows up with a drug that saves your life, it's akin to that. It's life-saving and life-changing in that way.
And the biggest thing for me is it's not open heart surgery, not
so
open up the chest.
They're not cracking the ribs or the sternum to...
They're sneaking in through the ribs.
Through a rib. Right.
Unbelievable.
And the really cool thing about this is once you're treated for it, you're pretty much good from what I was hearing from him. It doesn't seem like it's a procedure that you need to keep getting done, every 5 years to make sure that it's good. It seems like you're pretty much treated once this is done and you're kind of through it.
That's amazing. Yeah. And it's so often we don't get news about how to really help people who are basically facing death. Mm-hmm. And this is just one of those things where it should be like a boom through the medical community going, wow, look at this thing.
Absolutely.
That we can do. Oh, that's amazing.
And it's all done here in Phoenix at Banner University Medical Center. One of our doctors there just he saved lives. It's incredible.
And just, sort of like, oh, what if I do this? I love it when people think out of the box.
And ta-da, and there it goes.
Well, thank you so much. We appreciate your time, Colton.
Thank you, guys.
Thanks for watching Arizona's Morning News. Click to watch more from KTAR News and hit the button in the middle to subscribe.